New tonight, doctors are predicting cancer death rates will spike because of the pandemic. They say the missed screenings and fear of the virus are a big part of the problem. They're already seeing some patients come in who are already advanced cancer cases. WMAR2 News' Aaron McPherson has the story for us tonight.
Hospitals are taking every precaution to keep you safe from the coronavirus, no matter what you're coming in for.
I feel very safe every appointment I've gone to.
Nina Teresi has been in the doctor's office a lot more than she'd like to be lately. She has stage 1 breast cancer, just diagnosed last month. She had a lumpectomy on Tuesday, her cancerous cells removed.
If I had waited till after this pandemic, it definitely would have been that much bigger, and potentially I might have needed chemo instead of just radiation or something like that.
She originally was scheduled to have a mammogram in the spring. Screenings were canceled with the rest of the shutdown, so it was delayed until the fall.
They called me a week later and said, yeah, you have some cancerous cells. That I don't have any lumps, I didn't feel anything, so I would never know if I hadn't gone for my annual exam.
But many people aren't going to their regular exams, even though they've been open.
There are still patients who are very afraid to come to medical facilities.
Dr. Man Farha is the medical director of the breast center at MedStar Good Samaritan Hospital, telling you it's safe to come in for screenings or treatment.
The transmission in medical facilities have been very low for the public. Nurses and providers who see patients with COVID in the hospital are the highest risk. But most patients who come to the offices or have an outpatient encounter or outpatient procedures, the transmission of the COVID is very, very rare.
And if you don't feel comfortable, there are other virtual options. Telehealth is a great first step, but ignoring it altogether is not the answer. Dr. Farha has seen several patients just in his field who've waited too long to come in for help.
This really puts the patient at a very huge risk of from something that's normally curable to something that has a 50-50 chance of survival.
The earlier cancer is detected, the higher the survival rate.
I wouldn't be surprised if over the next few years we have blood tests that would screen for a number of cancers, especially the ones that are hidden and hard to diagnose. I'm very optimistic about that.
One healthcare company, Grail, is working to detect cancer earlier. They have clinical studies for multi-cancer early detection, using a blood test that could detect more than 50 cancers. For the time being, you're encouraged to come in, do your screenings, and especially get checked out if something's not right. Teresi is grateful she decided to come in for her annual exam and is urging you to do the same.
My friends keep asking, how can they help? What can they do to help? And I just tell them, go get your mammogram. If you haven't gotten it this year, it's safe. Go get it. I've gotten 2 now. I'm in the doctor's office. It's fine. Don't wait. Don't be scared.